Hello, friends. Greetings from Miami. We meet again today to discuss another very exciting clinical trial, a first-in-human combination clinical trial. Now, a lot of content on LACNet website revolves around well-differentiated neuroendocrine tumors. I'm very happy that LACNet is also focusing on higher-grade neuroendocrine cancers. So neuroendocrine cancers is a spectrum of disease from all the way well-differentiated low-grade NETs to higher-grade poorly differentiated neuroendocrine carcinomas. Today, we will talk about an interesting study in the higher-grade poorly differentiated carcinoma domain, especially small cell lung cancers. Poorly differentiated neuroendocrine carcinomas could be of different subtypes. Please refer to a recent lecture that we did for LACNets on this topic, where we take a deep dive into classifications and how do we go about managing those cancers. One of the important type of poorly differentiated neuroendocrine carcinoma is a small cell lung cancer. It's a distinct entity in its own right. About 14 to 15% of all lung cancers are small cell lung cancer. So it's not a trivial disease. A large patient population across the globe, unfortunately, affected by small cell lung cancer. And some of the humbling facts about small cell lung cancer are that it's a highly aggressive and lethal cancer. The 5-year survival rate for small cell lung cancer for extensive disease are in the range of 10 to 13% in the current era of immunotherapy. So a lot needs to be done to advance our therapies and improve the patient outcomes in this space. Today, we will be discussing a clinical trial which is combining a radiopharmaceutical. It's a RAZI-Bio study, which is testing an actinium-based PRRT agent in combination with the current standard of care chemo and immunotherapy in the frontline setting for extensive stage small cell lung cancer. So as of today, the standard treatment for patients who are diagnosed with metastatic or extensive stage small cell lung cancer are a combination of carboplatin etoposide or a platinum-based chemotherapy with one of the immunotherapy agents, either atezolizumab or durvalumab. And addition of immunotherapy to chemotherapy has definitely shown benefit in overall survival. However, that addition of benefit overall survival was very modest, about 2 months. So there is need to improve the effectiveness of this upfront chemoimmunotherapy combination by several folds. And that's where targeting somatostatin receptor positive small cell lung cancer tumor could be a potential option for some of our patients. So small cell lung cancer, just like our well-differentiated neuroendocrine tumors, can also express somatostatin receptors. Maybe not in that quantity, but from our available data, it seems 30 to 50% of small cell lung cancers may express somatostatin receptors. We also know that small cell lung cancer cells are highly radiosensitive. They respond very well to radiation-based treatment. So if there is a way to screen patients who express somatostatin receptors and then treat them with a radiopharmaceutical drug that targets somatostatin receptor, could be a potential breakthrough in this area. And that's what the concept for the current RAISE 101 study is. So it's combining actinium 225 based somatostatin receptor targeted radiopharmaceutical in combination with carboplatin etoposide and standard of care atezolizumab. This is a phase 1 study. It's a multi-center study. It's open at various centers across the US and outside. We are very soon opening it at University of Miami ourselves. We're very excited about this particular study. And this study will test different doses of the PRRT agent, and will understand if we can safely combine this radiopharmaceutical with the chemo and immunotherapy. As patients get treated with higher doses, we're going to eventually assess a recommended phase 2 dose, which we can then further test in phase 2 and phase 3 trials. So very important study in this area. Is a critical unmet need. And please check out the link below with the clinicaltrial.gov for the details where the available sites might be. You might want to look into those sites and you can get a general idea about eligibility criterias and general treatment schema. But very important study, very excited to see how this pans out. Thank you so much for listening in.